Hi, this is Bill Pong, week number 4. This is respond to chapter number 7, case number 1. Does Joe have a right to refuse treatment on the respirator? The answer is yes. Patients reserve the right to request and refuse treatment. In the healthcare setting, we must protect the patient's autonomy as well as their dignity. However, the physician must assess several key factors, as if the patient is competent when making his or her own requests, the risk versus benefit of the request, and if it is medically indicated. Do the physician or nurse have a right or duty to help him physiologically and pharmacologically overcome his anxiety when taken off the respirator? The answer is yes. The healthcare team should do what is medically indicated and is in the best interest of the patient, especially when the patient's prognosis is good and is only held back by overcoming anxiety of being off the respirator. So alternatives should be considered, such as medications, psychological support that can ease the weaning of this patient off the ventilator or respirator. Do the wishes of the family have ethical or legal weight in such case? And the answer is yes. Healthcare providers must assess both ethical and legal consequences of the family's wishes. Healthcare provider must protect the patient's autonomy and consider if the the family's wishes are supporting or overriding patient's wishes. Make sure that we are acting in the best interest of the patient. The ethics committee might be able to assist in such cases. Is the mere fact that the patient may sue a justification for not following expressed wishes of a competent patient? Absolutely not. The physician must assess if the procedure or the action is medically indicated. Also, the burden versus benefit. Is death imminent? Is this just prolonging life? Is the action protecting the patient's autonomy and dignity? The physician must act in the best interest of the patient, preventing any suffering and performing what is medically indicated. Chapter number 7, case number 3. Is the patient's living will the directional document at this point, since all family agreed with the wording and the intent of the document? Well, the patient's living will may not be the directional document because it is not witnessed, but it is subject to consideration and interpretation. Her living will clearly states that she only wants to live if she can be independent and live in a quality existence. Her will does not include verbiage that she states it will go into effect when she is in a terminal condition and permanently unable to decide for herself. So despite the family's refusal of the procedure, the physician must take into consideration the following key factors. Number 1, the patient is not terminal. Death is not imminent, nor is she in a vegetative state. Also, her condition is not irreversible, and she is not permanently incompetent. Her incompetence is due to the effects of the medication and her situation. Her prognosis is that she is expected to recover and likely to become independent, but it will take months. Also, continued existence is not more evil than termination of existence in this case. The medical procedure is medically indicated. The benefit to perform the procedure outweighs the bad. Tracheostomy will continue to ventilate the patient, would do good for the patient. Denying this procedure would be unethical. It would harm the patient and cause death potentially. It would not be a proportional reason. In absence of a valid patient living will, the physician's obligation is to protect the patient, and the obligation is to the patient and not to the family. Although the family's wishes should be taken into consideration, overall, the physician has the obligation to protect the patient's autonomy and make decisions in the best interest of the patient and not the family, especially when there is evidence that that the surrogate is acting against the desire and the best interest of the patient.